All right, guys, we're going to get started. I'd like to welcome everybody. My name is Suzanne. I am a physical therapist and Pilates instructor here at the Sports Medicine Center for Young Athletes. And I'm part of the dance medicine program, which is what's hosting this event tonight. There are going to be two other speakers, Dr. Colleen Sabatini and Danielle Bergstead. Did I pronounce that right? Bergstead. And we also have Vanessa Chu, who's over here sitting too. She's not presenting, but she's also part of our dance medicine team. Our bios are on our photos and names are on one of the flyers in your handout there. And our bios will soon be on the website. But thank you so much for coming tonight. We're so excited to see like a nice turnout of young dancers here to learn more about readiness for point. This is going to be great. We've put some good work into putting this together for you guys. And yeah, so we're just so excited to have this dance medicine program where we're here to help all types of young dancers with injuries, injury care, preventative strategies, nutrition. We have really a comprehensive program here. So we hope to teach you more about it tonight, and it's ever evolving. So I'd like to start by just introducing our Dr. Colleen Sabatini. She is a pediatric orthopedic surgeon, and she's also the division chief of orthopedics here. She's the head of our dance medicine program. She has been a dancer since the age of 3. She danced all through college and taught through college and medical school as well. She has extensive history in ballet, tap, jazz, and lyrical, and I'm sure she's willing to tell you a little bit more about that too herself. So she's going to kick off the presentation. Come on up, and I think we're good to go.
Okay, you just have to, how do I make that show up there?
Oh, here we go. There we go. Okay, fantastic. All right, good to go.
Hi, everyone. So I started dancing when I was 3, but I stopped dancing when I was about 30, and that was a few years ago. So I have about 27 years of dance experience, and hopefully you guys will never stop dancing. Once you do, it's a little hard to go back. But don't, because it's such a fundamental piece of who you are, and it's nice to have that carry you through life. So if you become a surgeon, things get really hectic, and it's hard to find time for dance, but just never stop. That's my one piece of advice that hopefully you'll leave with tonight. All right, we're going to go around the room because I just kind of want to get a sense of what we have here this evening, who does what kind of dance and all that. So just really quick, first name and what kind of dance you do.
I'm Olivia. I did ballet for a while, but going into high school it was too much homework, so I just danced with our dance team, so we mainly do jazz in high school.
I'm Lucy. I don't dance for here for our sports medicine class. Fabulous. You're just dipping in to see what's up. Sounds good. I'm Jessica. I was a competitive Irish dancer for almost 10 years, and then I'm also in our school jazz.
And what school is this that you were on? Albany High School. Excellent. I'm Sarah. I'm like I don't dance.
Perfect.
I'm Anna. I do ballet, tap, jazz, lyrical, and acrobatics, but I also dance.
I don't know how to represent.
Hi, I'm Tanya. I'm in the prom, and I don't dance.
No dance? You're not a recovering dancer right now?
Not at all. I'm trying. We're keeping it kind of I'm Karen Lesko. I work for a student in physical therapy, and I started doing more challenging Scottish dancing just recently in my life, which I love. And Scottish dancing has the Highland dancing has some similarities to ballet, and I see a lot of people around me with injuries, and I'd love to hear more about some of the approaches to, especially with, strengthening and preparing people for this kind of dance.
I'm Vanessa. I was already introduced. I'm one of the physical therapists on the dance medicine team, and I was trained in ballet and jazz and tap when I was younger. And I still dance, and I'm taking and teaching hip hop, and that's it.
Hi everybody, my name is John Kretschmer. I'm a third-year doctoral physical therapy student over at UCSF. I'm an old friend of Vanessa's. I'm a former professional trumpet player, and I'm on faculty at the San Francisco Conservatory of Music, and I have an interest in all of the performing arts, so I'm here to learn more about dance. I am not myself a dancer, but I'm here to learn more.
On the inside.
Are you pre-point, on point?
I'm Isla and I also do ballet. I'm Isla and I also do ballet.
Pre-point.
Yeah.
Excellent. We know what you mean.
I'm Sophia and I do ballet.
I'm Cherish, I'm her mom. I did some dancing when I was young, but not
That's the quiet daughter.
Somebody who doesn't want to talk to us right now. Nothing.
I'm Michelle. I'm a physical therapist here, in awe of all dancers. I've been working in physical therapy for 20 plus years, and I think the dancers are the most amazing athletes. And my sport is soccer, but again, I am in awe of dance and need to learn more about how it becomes so amazing. And this is my daughter, Bellies.
Who doesn't want to talk to us?
Not
I'm Jessica. I'm a PT intern here at the Sports Center for Young Athletes, and I'm very excited about this program. Dancer my whole life, yoga teacher, Pilates trainer, triathlon instructor.
I'm Mila. I'm a ballet teacher. I'm a ballet teacher. Actually, I know we're going to be here.
Did she get extra credit for being here? Then you guys have already been introduced. So perfect. So, nope, good. Okay. So I was asked to talk a little bit about just injuries in dancers. And that sounds like, I'm glad we did that because it's nice to know that not everybody is a ballerina and not everybody is necessarily a dancer but wants to learn how to take care of dancers. And so that was informative. Thank you for that. So like many things, dance is obviously varied. This we're going to focus a bit on our ballet dancers and our pre and on point ballerinas, but certainly everything that we're going to talk about is going to apply to all dancers across the spectrum. And the things that I struggled with as a dancer on point when I was a teenager were some of the same things when I was 30 and teaching hip hop. So some of those things are issues that you sort of carry through your life as a dancer and things that you need to know about and be aware of. So in terms of dance injuries, so we're just going to do an introduction to dance injuries, and obviously that's what we're here to learn about preventing. So there's multiple causes of dance injuries. The most obvious one is a traumatic event. So we all know somebody who's fallen in a dance class and landed on their arm and broken their arm, or twisted their ankle coming out of a leap or a turn and had an ankle sprain. Certainly bad landings are the cause of lots of injuries in dancers, and collisions. Everybody was supposed to turn left and somebody else turned right and they slammed into each other, and injuries can happen from that because somebody wasn't paying attention to the choreography. So traumatic injuries are absolutely a cause of problems for our dancers, and something that we're actually not going to talk a lot about tonight because those are things that learned choreography won't glide. But also we're gonna talk more about technique issues to try to avoid traumatic injuries. We're going to talk a lot about technique tonight because that is fundamental to the dancer. So if you don't have good technique, you're likely to cause yourself harm at some point. You can have the best of technique, but if you do too much of it too often, you're going to have an overuse injury, which is using something over and over and over again to the point where it gets injured and can't repair itself. And then certainly another cause of dance injuries are poor self-care. So as dancers, it's very important that you take good care of yourself, that you eat well, that you get enough sleep, because if you're not taking care of your body can't keep itself safe. It will be more susceptible to injury and not be able to repair itself when it does get injured. The good thing is that the vast majority of dance injuries don't require surgery, so that's good. You don't need me to fix you. What you need is you to fix yourself in the vast majority of these cases that we're going to talk about. So one of the things that makes dancers unique is that sort of where the injuries occur. So unlike other athletes who might have sort of an equal balance between upper and lower extremity injuries, dancers predominantly have problems in their legs, so from the hips to the toes. We also get problems in our spines, predominantly in our low back, which we'll talk about. And then in some cases, there's some arm injuries. And usually arm injuries are more related to the falls because it's hard to hurt your arms in dance from overuse since they're more placement and ornamental as opposed to functional. But if you fall and land on your arm, then something could definitely happen. All right, so for the purposes of today, we're not really going to talk about trauma, not really going to talk about overuse, and just know that you have to take care of yourself if you expect your body to take care of you. So we're really going to focus on technique issues as a cause of dance injury. We're going to talk about sort of all the areas where we can get pain as dancers. And we're not going to talk about the arms, because as I said, just try not to fall and maybe you won't hurt your arms. But we're going to talk about back, hip, knee, and foot and ankle. So back pain. Back pain is unfortunately very common in young people. I see a lot of patients every day who have back pain. Some are very active people with back pain. Some are completely inactive, and that's why they have back pain. But the more types of things you do, sometimes the more susceptible you are to injury. So certainly for dancers, we know that there's a lot that we ask of our bodies, and sort of contorting and twisting and turning and spinning can cause some strains or pulls of our back muscles. So that's one of the things that we have to be aware of, and you need to make sure that you are warming up ahead of time and that you are cooling down with a good stretch afterwards. Your muscles will appreciate both the warm up and the cool down. Low back pain is probably the thing that I see second to knee pain most in our young dancers. About 70% of back pain in dancers is in their low back. And does everybody know what I'm talking about with the low back? It's the low part of the back. All right, so back here, we call it the lumbar spine area, but it's not usually the spine itself, which is midline. It's usually the side muscles, okay? Low back pain is often because the muscles are imbalanced. So one part is too strong, one part is too weak, and they're fighting against each other. Does anybody know what hyperlordosis is? I'm teaching you doctor words. What? Nobody knows what hyperlordosis is. So lordosis is a curvature of the spine where the spine goes in. So you know, if you look at somebody from the side, everybody's got that little booty bump back here, right, where the little butt sticks out because they have this little arc in their back here. All right, and I'm sure you've all seen in dance class somebody who is sticking their little butt out instead of tucking their pelvis underneath, right? You probably all got in trouble in dance class for doing that, because you really need to tuck that pelvis underneath and keep it tight, all right? If you let that butt stick out and you hyperlordose your spine, you're putting a lot of pressure in that low back. And that's not necessarily just when you're standing at the bar doing a bar exercise, but in any action that you do where you're coming to the back, if you sink into your back and you stretch through that low back, that's a hyperlordotic motion of the spine, and it's going to lead to pain. That's where technique is so important. Not only does it not look good to do that, but it also doesn't make your back feel good. Bless you. And then poor core stabilization. So our back is totally dependent upon our front. If your core muscles, these muscles here, are weak, you're putting a lot of pressure on your back, especially dancers who are doing all sorts of amazing movements with their body. If you're sitting into your core and not engaging those muscles, your back is taking all of that pressure, okay? And very rarely is there actually a problem of the bones themselves, and that's something easily pronounced as spondylolysis and spondylolisthesis. And those are actually little breaks of what's called the pars intra-articularis of the lumbar spine. You don't need to know this, but those are sort of the one thing that we as doctors and as physical therapists and people who take care of the medical aspects of things worry about. And if a dancer has a lot of low back pain, pain when they extend back, pain that won't go away with appropriate rest and physical therapy, that's something that we think about. But in the vast majority of cases, low back pain is absolutely something that the dancer can control. Hip pain. Has anybody ever had any hip pain? What kind of hip pain did you have? Do you remember, if you don't mind sharing?
Yeah, it was kind of like a stabbing sensation in the front, like where the inguinal region is.
Yes. And what made it go away?
I think it was a lot of stretch. Like part of it was resting, and then light stretching, just trying to increase mobility.
Perfect. So hip pain is very commonly an overuse problem, so she rested, it got better. And it's very commonly a tightness issue, where some of the muscles are too tight, some of the muscles are maybe even too flexible and too weak to support the hip. So it's actually a very good example. Thank you. So lots of dancers get pain right in the front of their hip, that's in the hip flexor area. And in young people who are still growing, there's actually open growth plates in the front of the hip that can get some inflammation through them when we tend to pull the muscles that are connected to them a lot. So there's lots of dancers who get pain when they're doing things to the front. So any kind of The belly to the front or battement to the front can cause pain in the hip. That's often where you get that sort of stab anytime you lift the hip up, because that hip is really working hard. And if our hip flexors, so these muscles in the front, if they're a bit weak and a bit tight, and the lower abdomen is weak, we do a lot of things where we're really kind of falling into that hip, and it can cause us problems. Does anybody in here have a snapping hip? Yes. So I had a snapping hip. It was a huge problem for me when I was about 13 years old. Anytime I did développé à la seconde to the side, every time I brought that leg down, it would pop, 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 okay? And it started to hurt after a while. So a snapping hip can happen to the front, where there's a muscle in the front. There's a tendon in the front that's snapping over one area. It can happen to the side, where there's another muscle snapping over, so it's called the iliotibial band, and the tensor fasciae lata is snapping over our greater trochanter, okay? Why does that matter? That matters because that happens because of muscle imbalance. And if we work on keeping our core strong and our supporting hip strong, usually those kind of things happen when you fall into that supporting hip. Your dance teacher's always telling you to lift on that supporting leg, right? Don't sink into your hip. If you sink into your hip and everything shifts, you can't support your pelvis the way that you need to. So listen to your dance teacher when they're telling you those things, because having a nice stable pelvis is important for preventing injury, okay? And then very rarely, and some dancers in particular, because of all of the crazy things we do with our leg, where they're like up here and over to the side and things that don't think that they intended when the human body came to form, we can actually injure something within the hip socket itself called the labrum, and that's a pain that doesn't really get better despite rest and physical therapy, and that's when you end up with me. So these are sort of three different areas where we can get this snapping hip or hip pain problem, and there could be on the outside of the hip where our iliotibial band is rubbing, and that can be because we really need to work on the flexibility of our iliotibial band and the strength of our muscles. It can happen in the front of our hip from that psoas tendon coming in to the front of the hip, and we need to really think on our battements and anything to the front that we really need to lift on that supporting leg and lift from below, not heave it from above. You know, your teacher probably tells you that, to not be like, and try to kick it up, but to lift your leg, okay? You wanna lift it in a nice gentle way, not kind of heave it up like it's on a crane. And then the pain that can happen deep inside the groin. The deep inside of the groin pain is the pain that you have to let your doctor know about. All right, knee pain. Has anybody here ever had knee pain? Probably just about everybody in the room, okay? Because knee pain is unfortunately incredibly common. Number one reason why we as orthopedic surgeons see young athletes of any kind, specifically dancers. And the most common form of knee pain is pain right in the front of the knee, all around the kneecap, sometimes above, sometimes below, but usually around the bottom of it. And often it's this thing called patellofemoral knee pain. And all that means is patella is the patella, which is the kneecap, and the femur is the big bone of the thigh, where the kneecap sort of tracks inside this groove in your femur. And when that kneecap is bouncing around back and forth instead of sliding up and down nicely, you can get pain on the back of your knee. And it does that when the kneecap is getting pulled one way or the other instead of nicely up and down. And the number one reason to get pulled back and forth like that instead of just nicely up and down is a mechanical problem. Most commonly due to a technique issue, a muscle imbalance issue, or a combination of those things. So, who has ever cheated their turnout? Probably everybody, right? So when I say cheat your turnout, right? So if you naturally go here, and this is your good turnout position, but your dance teacher or yourself wants you to get to here, right? I just cheated my turnout. I didn't just turn out from my hips, I just turned out from my knees, okay? And if I turn out from my knees, and then I go to do a plie, hopefully I don't break myself. Call the doctor. I'm purposely trying to look bad. All right, so if you are turned out more than your knees, than your hips are able to turn out, your knees are going to go in front of your toes. Does everybody understand that? Right, so that's a poor technique issue on your turnout. You're going to overstrain the inner part of your knee by forcing that. And your kneecap's going to go in while your knee itself is going out, and your poor little kneecap is going to be miserable. All right, muscle imbalance. Anybody can think of a muscle imbalance that might make your little kneecap not go where it belongs? The most common one, and it's pretty much universal in most young female athletes of any kind, the outer muscle here is stronger than the inner muscle here. And when we fire our quadricep muscle, this muscle pulls more, and our little kneecap goes to the side instead of staying nicely balanced where it belongs. So that's one of the things that we really have to think about and work on is balancing our quadricep muscles. The dance surface that we dance on is very important. If you're dancing on a hard surface and landing on a hard surface over and over and over again, that's more shock to the system. You're not going to land as well. You're going to have more difficulty. So that's why you really want to dance at a studio with good floors that we call sprung floors, and not dance on concrete, like I can remember doing many times when I was young. All right. If your external rotation muscles in your hips are weak, then you are going to put increased force across the front of your knees. So it's very important in dancers to make sure not only is your core and your quad strong, but your hip abductors, external rotators. That's what gives you your turnout. That's what holds your turnout safely. And that's what keeps you in good alignment so that you don't hurt your knee. And then tight hamstrings. Who would think that a dancer would have a tight hamstring, right? Like, dancers, by definition, are supposed to be very flexible. You'd be surprised how many dancers I see who don't have good hamstring flexibility. And so you really need to work on your flexibility and making sure that just as you need to be strong, you also need to be flexible. And it often works the other way, that dancers are more flexible and not strong. So we have to work on both those things. And then you must think about your landing, okay? So can somebody tell me which picture they like and which one they don't like? Which one's good? F is good. E is bad. Why is E bad? So one of my young people. Yes, ma'am. Exactly. So everybody sort of put your foot on the ground underneath the desk. And then roll so your pinky toe is off the ground. Right? So if you roll your pinky toe off the ground, we are rolled in onto the middle side of our foot. We're rolled in on our foot. Some people call that pronation. Some people call that other things that are not. So when you roll in your foot, you're not well balanced, and your knee is going this way when your body is trying to go this way, okay? And then what else? So you said that her knee's going forward, right? So instead, it's that thing that I was talking about before. I'm too old to do this and not break my knee. So at any time, so everybody stand up. This is interactive right here. Everybody stand up. Stand on one leg. Lift through that supporting leg. Engage your core and do a demi-plie on that leg. And think about where your foot position is. Okay? You should be nicely balanced on your foot, not rolling in, not rolling out. We don't want any sickling while we're standing. Okay? And then your knee should go directly over your toes. So look down and make sure your knees are over your toes. Okay? If you take that plie lower, think about where your knee is going. Some of you might find that you're starting to take your knee in, and that is bad. All right? You must keep that knee locked so that not locked, but like sort of laser focused, so the kneecap is going over the toes. In order to hold that position, think about, we don't stop very often and think about what we're doing. My quad's on fire right now, and I expect everybody else's to be on fire too, because we're all been balancing in demi-plie for quite a while now. All right, so your core should be engaged. You should feel your quad all across the front engaged, and these muscles right back here on your butt. Everybody put your own hand on your own butt and feel those muscles. All of those muscles have to work in order to hold yourself up in that position, okay? And if any of those muscles stop working or not do their job, you're going to fall in, fall out, fall over, okay? So it's very important to make sure you have good technique. You can sit down. I'll make you stand up again in a second. All right, which one do we like? This is very easy because it's like the same on both sides. Somebody tell me why G makes my heart hurt and H is good. Anybody? Albany High represent. Oh, yeah. Hi.
Alignment's high. Her alignment's off, and then also she's once again rolled on off of her big toe and not really touching all the way throughout all three sides.
Absolutely. So she's totally rolled forward onto her great toes. Her knees are in front of her toes. Her core is sort of sloppy. You can see that she's not very engaged, although her shoulder position is reasonable. So we don't like that because that puts way too much force across the front of the knee. And then 8 shows that she's pulled back. Her feet are balanced. Her knees are over her toes, just where we like her to be. Okay? So foot and ankle injuries are also incredibly common in dancers. Sprains are probably the most common thing in the foot and ankle that we see. Sprains are an injury to a ligament. And so if you land and you do this, which is the most common ankle injury that we see, then you're going to pull really hard on the ligaments on the side of your ankle, and you can injure them. And you can also break the bone, but you can pull on the ligaments. It can be a mild injury that takes a couple of days to a couple of weeks to heal, or it can take several weeks to heal. Okay? Oftentimes sprains are because, again, poor strength, poor proprioception, which is that ability to balance yourself in sort of space as you're moving through positions. If you're really tired, you're going to be more likely to have an injury where you get a sprain or a break. Poor technique, always. And then obviously slippery floors, right? So we think about you can be the best possible dancer ever, totally focused on technique, doing a great job, and you hit sweat on a floor and you can fall over and hurt yourself. And then we can strain things, so just like we can pull on muscles and injure muscles, we can strain things from poor technique. So one of the most common things is sickling, right? So it's the same thing. If you're up on releve and you sickle, you roll those ankles out, you're putting a lot of strain, you're putting a lot of abnormal force through the outer part of the ankle that can cause injuries. Does anybody know where their Achilles tendon is? You should, because there's a picture of it. Everybody feel their Achilles tendon. Right? It's this big, tight structure in the back of your ankle, okay? Your Achilles tendon is very important, and we don't love it enough, okay? So you have to make sure that you are giving lots of love to your Achilles because it's a very common area of pain and injury to dancers. So it can get very inflamed from all of the things we're asking our Achilles to do all the time. If you think of just going from a demi-plie, where it's on stretch, and then it contracts to pull yourself up, and then it goes into releve, where it actually gets shortened, right? And then you come back down, and it gets stretched, and then you go back up into releve, and it gets shortened, and you're going back and forth through all this motion and causing all this stretch and relaxation of this tendon, and then it's the thing that's really holding your body up. When you're up on demi-point or on full point, your Achilles is doing a lot of work for you, so you have to take good care of it. When you sickle, so roll out or roll in, you put a lot of force abnormally through the tendon, it can get inflamed. If it's very tight, so we actually have a lot of dancers who have very tight heel cords, and that contributes to significant pain. And I know Susanna and I have shared many a patient who that is their one problem, is that they have beautiful hamstring flexibility, they have beautiful everything flexibility, but nobody ever taught them to stretch their heel cords. And if those are tight, it can mess everything up because you get all that inflammation through those Achilles tendons, and it causes pain every time you land. You have to stretch through them, okay? It's important when you're working at the bar, for example, and you're going into your grand plie and you come up, make sure those heels get down to the ground as soon as possible, right? You don't want to be that dancer whose heels are like floating up in the air and then eventually come down. You get those heels down to the ground into when you hit demi-plie, and then you come up. You don't want to miss that opportunity to stretch those Achilles tendons while you're dancing, okay? And then make sure when you land that you don't just sort of land it. You have to land your jumps or your leaps and then stretch through that area so you get a good stretch through your Achilles. And then this is something that people talk a lot about in dance, because dancers, particularly ballerinas, are really the only athletes that have that kind of problem, right? Like, who else is all the way up on their toe like that and asking the foot to do something that it was never, sort of architecturally designed for? So posterior impingement is basically when we spend a lot of time in releve, we can get a lot of pressure pushing in the back part of our ankle. And there's some tissues back there that can get smushed, and that can cause inflammation and pain. There's also some people who can be born with a little extra piece of bone back here, and it's called an os trigonum. And that is usually not a problem in anybody who's not a dancer, because it doesn't get squished unless you're up on extreme plantar flexion, like in demi-releve or releve there. And so in some dancers, we actually have to go in surgically and take out that little piece of bone so that they can continue to go into releve. The rest of us who don't have that little piece of bone, if we're having pain back there, it's usually because of technique, overuse, and we need to fix those things so that our ankle feels better, okay? And then going into some of the stuff we're going to talk about in a little bit, there's lots of things that can happen in the foot that are because we're just not taking good care of our feet. We're not wearing good shoes. We're not padding appropriately. So we get kind of those gross dancer feet problems where we have calluses and corns and our toes look funny, like I won't ever take my shoes off. We can get bunions, those types of things. The plantar fascia is that tight structure in the arch of the foot. Everybody can feel their own plantar fascia. So bring up your foot and reach in and feel that arch of your foot here, midpoint of your foot. Everybody should feel a tight band through there. It, like the Achilles tendon, can get very tight. And if it is tight, it's hard to do anything in dance because you're standing on that foot, that plantar fascia is getting stretched, and it can become very inflamed and hurt if we are not taking good care of it. So when you force your turnout and you are rolled in onto the medial part of your feet, it stretches that plantar fascia, and that's not good. And then certainly lots of dancers can have problems with breaks of the bones in their feet. So whether it be something where it's repetitive over time and the bone is not quite broken but kind of about to break, which is called a stress fracture, or an actual broken bone of the foot. And the most common one is the bone on the side of the foot, which can break when you land wrong and twist. And that's actually called a dancer's fracture because dancers are the most susceptible to injuring the bone just in that exact place. Other people hurt it more up here, but dancers in particular tend to break it right in the middle of that fifth metatarsal. Okay? So, here's another example. What's good, what's bad? A's good. Thank you. Oh, is anybody going to argue with me? A is bad. Why is A bad? Somebody else hasn't talked yet. Yes, ma'am.
They're pronating a lot, and so it's a lot of stress, and they're not over it at all.
Right. So they're totally rolled in on their feet, right? So that's the number one way to cheat a turnout. Everybody stand up. Then we gotta go. And then I'm done. Okay, everybody take the turnout. So wherever you're gonna put it. Okay. Everybody feel good? Do a demi just to make sure that it's a good place for your turnout. Oh, this is fabulous. I love my turnout. Now everybody take it one step more. Okay? What is the first thing that you noticed that you did in order to do that? I don't know about you, but I rolled forward through my ankles. Okay? So I rolled and I feel now a pull on the inner part of my foot and on my knee right here. Okay? That's exactly what this person in this picture is doing. They cranked their turnout and now they've rolled forward. And think about what that does to the top of your body, right? So now you're pitched back. Your back is like you're sort of leaning yourself back. And usually your core doesn't do a very good job holding you up. So see how I'm about to topple forward? Okay? That is what a lot of people do every day when they're dancing. And try to imagine looking good and doing well, teetering on the verge of falling forward on your face. Okay? That is why it's very important in dance classes to protect yourself. And if your teacher's coming along and saying, we need more turnout, we need more turnout, don't do this and twist your feet back. Okay? It shouldn't happen that way. You should be able to naturally fall into your position. You can work on your turnout over time, but don't crank your turnout. All right? Same thing here, but this is in releve. You can see that they're rolled forward in C, and they're nicely positioned in D. Okay? So, just to sort of wrap this up, there's lots of things that can happen in a dancer's body. Okay? The point of going through all of those different areas that I see every day dancers struggling with is that for the most part, these are preventable things. And worrying more about your technique and getting your technique solid than how high your leg goes or how many turns you can do. Technique is important. It is the fundamental. So don't cheat your technique. Your technique always has to be there. So I don't care if you can go to 180 degrees if you're on your turnout, if you're hurting yourself and you're not going to be able to dance next month. I'd rather have you here and be able to dance forever. Okay? So don't force that turnout. You have to strengthen the weak and stretch the tight. Okay? So you work with your dance teachers, you work for yourself, and you think about what are my muscles that are weak, what do I need to work on? You work with our great physical therapists, they can help with those kind of things. So you have to strengthen what's weak, stretch what's tight. And that remember that dancers are athletes and they must cross condition just like any other athlete. So I know most of my dancers are going to dance 5-6 times a week, but you need to work on your cardiovascular fitness, you need to work on your strength training, not just on being an amazing dancer, because it's those other things that are going to help you achieve the dance goals that you have. And then you have to make sure you're drinking lots of water, not soda, not Gatorade, water. You have to eat well, meaning your green leafy vegetables and your yummy fruits, not your stuff that comes out of bags and leaves weird orange stuff on your fingers. And you need to get plenty of sleep, because those are the things that are most important for repairing your body after each class and helping to prevent injury. Okay?
All right, you're done.
I'm done.
All right. Okay, so this next part is going to be interactive. So I'd like to invite everybody to find an open space, because you're going to be standing. We are going to go through our point readiness assessment. This is going to basically give you a nice test to see if you're ready for point.
And even if you're not a dancer,
Yeah, everybody.
Come out here. We have dance feet. If you want to take your shoes off, take your shoes off.
Okay. So, just so everybody knows as well, this is recording live as well, so there are people watching this from their computers at home, and everybody, please use the space, not just Jessica. So everybody, yeah, come on out. You can use the side space up here. Yeah, fill this area as much as you can.
All behind represent over there.
Okay. All right, so this point readiness assessment is not something that we actually created. It's something that we're using from the NYU Harkness Center for Dance Injuries. They designed it to test flexibility, strength, balance, and just overall preparedness for going to point. And they've researched it and validated it, and so we're using it. And so that's where it came from, just so you know. The first criteria is, let me just step over here, is just a simple age criteria. So it's saying, are you 12? So if you're 12,
Or older.
or older, yes, or older, sorry, minimum of 12, great. But 4 ballet technique classes per week or 2 ballet classes per week with 4 years of prior training is good too. Okay, so you pass that criteria. It's not just specific to age. It's also an experience level. This next test is called the pencil test. We're going to be doing it seated. And I don't know if did everybody grab a pen on their way in? So just a kind of a simple thing is you're going to sit down on the ground, long sit. Yep. And you're going to take a pen. You're going to point your feet. And you're going to take a pen and see if you can rest it on the top of your ankle. Jessica, we have you just turn for the camera. Yeah, that way. Perfect. So what you're doing is you're basically resting it on the very top of your ankle. So it should touch the forefoot, the tibia, and rest right on the ankle. So, and be parallel to the ground. So Jessica passes this test. And so you'll know very quickly if you don't, because somebody who wouldn't pass would be more like here. You can see how the pen is angled upward, and there's a little bit of space there. You see that? Okay. So
It's basically an assessment of plantar flexion, your ability to point the foot. So you just should be able to rest right on top of your foot and be in contact with your foot and ankle the whole way.
All the way flat. Yeah.
Oh, no. It's across the ankle joint there.
Across the ankle joint, yeah. So some people, that's a good point, you might have more than needed. And that's not necessarily a bad thing if you control it, right? But we want to make sure that you have at least, yeah, exactly. Just a simple range of motion test.
So do you see how John, no offense, John, love you, man, don't know you, but love you, but see how he's going to not pass the test? So because he can't plantar flex his...
Come on up, John.
So this is a fail. This is a really good fail.
Oh, go a little bit that way.
Oh.
Just so the camera, yeah, thanks.
So I'm going to point the toes as much as I can.
It does look a little bit better. You can see it's still not parallel to the ground though, right? Yeah.
So that's a test of plantar flexion, because obviously you shouldn't be on point if you can't get yourself into that position in a healthy way.
Exactly. All right, stand on back up. Can you perform 20 heel rises on one leg with proper technique? So we already talked about proper technique, which is not being all on your pinky toe, not being all on your big toe, right? But you're going to rise up and down 20 times, full releve, without losing your balance.
With or without holding on to something?
Without holding on to something. Very good point. This is testing your calf strength, your balance, really a lot of things, because when you're balancing on single leg, you're using your core, you're using your hip to stabilize as well. So it's more than just your calf, but you should be able to do 20 raises for good calf strength. Counting their reps. Love it.
First one who gets to 20
Yeah.
gets a...
Let me know when somebody gets to 20 there. Yeah, the proper technique part is important. If you're rolling out and losing your balance, that's not so good. Okay. Everybody understand that one?
Yeah.
The nice thing with this test is that you can kind of turn it into a bit of an exercise, right? If you're having trouble with it, practice it, right? You can practice by holding onto a wall, etc. too. Moving right along, the modified Romberg test. So this is a balance test. You are standing with your leg not in turnout, straight. Your knees can't touch. Your arms are crossed and your eyes are closed for 30 seconds. Whoop, so if everybody gets there,
Yeah, I got it.
would you do the timing?
I'm timing now, you guys.
Eyes closed. Legs can't touch. Excellent.
10 more seconds, you guys.
10 more seconds.
And done.
And then obviously think about the fact that the leg you picked is probably your dominant leg, right? So everybody has one leg that they balance better on than the other. It's your stronger leg. It's the one you feel more secure on. So when you go home tonight, try the other side.
Try the other side, yes, please.
You have to be able to do it on both, since we don't go on point just on one foot.
Okay, moving on, single leg passe releve. So, passe releve. So, this one's challenging. This one is you have to hold your releve position for 15 seconds without losing your balance. So,
Without holding on to anything.
without holding on to anything. So, I was just going to technique something. So, you can be in turnout for this. That's okay. So you could go ahead and put your back leg in like a, coupe
Okay.
position. And then you rise up onto your releve and you try your very hardest to hold the top of the releve for 15 seconds. And full releve is the key.
Yeah, some of you
Not
are looking good, but you're only in.
Is it straight or turned out?
Either one is fine.
Either one is fine, actually, but turned out is
Preferable.
preferable, yes.
Something to work on.
Okay, challenging, one to work on probably, okay. The double leg lower test. So everybody lie back on the ground and have your legs pointed straight up toward the ceiling. So you're like all the way on your back. Your legs up to the ceiling, okay. We want to find kind of a position called neutral spine without getting too detailed. You want just like a small amount of space in your low back, like maybe you could slide maybe just a pencil under there, but no more than that. Then you're going to pull your belly button in tight toward your spine to stabilize, so you're engaging your core. You're going to glue your legs together. They can be in parallel or turned out, it doesn't really matter. And then you're going to slowly lower your legs down toward the ground If you can get to 45 degrees without the arch increasing in your back, excellent core stability. Okay, fantastic. Does everybody understand the part about the core being stable? If you're a little unclear about it, we can come by and help a little
Or we
bit.
can have Jessica demonstrate a core.
A core
That was
technique.
really good, Jessica. Can you show us what it would mean if we didn't use our core very well in this exercise?
Can everybody see? Just hold on, just.
Whoa.
Yeah.
Yes, do you see the difference?
Can you show the right way?
So everybody try that themselves. Do it well, and actually do it not well first. Right? So let those legs come down.
It's probably comfortable for your back.
All right. And what you're finding when you do that, right, is that your muscles, you're not using your core at all. You're just kind of letting your legs fall down, and you're getting sloppy. And that's what. Remember when I was talking about hyperlordosis? When you get that increased curvature of the small of your back, that's what it is. You can actually feel it when that space between your back and the floor gets bigger. You're hyperlordosing your spine. Okay. So if you keep your core engaged and you keep your belly button sucked into the ground when you do that, then you're keeping in good alignment.
Yes.
I can't read it, but did you talk where the hands should be? They should be on the floor on your.
Oh, they are, I believe, just by your side is fine. I think I've always had people do it by their side. I don't think it's specified. Yes.
So for good alignment, I understand like you're supposed to have your belly button to, or like by engaging your lower pelvic floor, and that is your belly button in. But how do you relax the top part of your rib cage and your diaphragm so that you're not like tightening up and you're still maintaining that good alignment without like, you know what I'm saying?
Yes. I do understand what you're saying. So you're saying how to not kind of flare your rib cage out?
Yeah.
Is that
like when my teacher was like, okay, you engage from here or from like she says you consider your baby muscle or whatever. But then it's like then she was complaining because I ended up going like this. And so it's like, but that feels right. If I'm doing this and I think that should happen, but she's like, no.
you like to jump in?
Oh, I'd love to.
Go for it.
Okay, so on top of our lower abdominals is what you're working with. We have our obliques as well, and they make a nice X that go right across here. So what you want to do is actually bring your rib cage down and connect it to your pelvis. I think about having wires that connect right here. So yes, you pull in through here, but you have to attach that all the way up to here. So can you bring your belly button to here? There you go. And your rib cage looks really nice. Now go ahead and go from elevate. Bring it to the top. And see how it feels a little bit more connected? Now go ahead and let your rib cage flare. See how it shifted your weight back a little bit and you lost a little bit of control. You can bring it back down again. There you go. Does that make sense to you? Or not?
Yeah. Everybody else should try that too. I think that's a really good point. So everybody stand up.
And those same cues can be applied to the laying down exercise, right? Connecting the rib cage to the pelvis. So, but go ahead and try it standing.
So go ahead and stand up. Take a nice deep breath in. I want you to feel your rib cage. What is it doing? And exhale. Just let it sit nicely. No tension right here. We shouldn't have a lot of tension here. If you have tension, then that's too much of a squeeze, okay? Bring in the lower abdominals, connect it to your rib cage, and then go straight up on your elevate, all the way to the top of your head. And I also think it helps to think about bringing your belly button to the middle of your shoulder blades. And that can also help connect that together. And back up.
And do you feel the difference between doing that and engaging here as opposed to like heaving out your chest and rolling your shoulders back, which is totally what you don't want to do, right? You can be soft up top, right? Because choreographically, your teacher might not want you looking all tense. You need to be relaxed and being able to be moving up here and dancing with your upper arms, but your core has to be engaged. So it's very important to learn how to do what we just described, which is being tight and lifted through the abdominals, but relaxed up top.
Okay. I apologize. The next one, the single leg step down. Oh, yes, that might work. Let's bring it over. Yeah, see if that will work. We forgot a step, but ideally you're on a 4 or 6 inch step. So this would be just like a stair at home. You could practice this on because we don't obviously have enough steps to go around. It will work. Okay. All right. So what you're going to do is, thanks, Michelle. That would be great. So go ahead and bring your body to the side so you're essentially in a first position, plie position. Yeah, but this foot being like here and this foot floating off the edge. So you can use my shoulder if you need to for balance. Yep. So you get on the edge of your step at home, okay? And you put one foot is going to be supported on the step, one foot is going to be floating. You're in your tall posture, okay? And now from here, you're basically doing a plie on just your right leg. This leg's dropping down. This is too high for her. I can already see, so obviously don't touch the ground. But go just as far as you feel comfortable. And
Before the heel comes up.
Yeah, where you feel like your heel's going to pop up is your stopping point. Now, things that we would be looking for with this is the knee tracking in the midline of the foot, okay, over the toes. Is the pelvis staying level? Because could you quickly do a drop of your pelvis like that? So is the pelvis dropping? Because if it drops, that means we have some problems with our hip abductor, some of these side glute muscles, okay? And then again, we want to control that knee to go midline of the foot. So take a look at this one at home on yourself. You should be able to do 4 out of 5 plies with good technique. Technically a lot more than that, but for the test. Okay? Does everybody understand that? Okay. Then I'll kind of an alignment test. The airplane test. So everybody make sure they have enough room that their leg can lift up behind them. Okay? So standing, yeah, that was perfect. I was going to say stand to the side. So standing with your feet in parallel, your hips are pointing forward, okay? Your arms are just going to go out to the side from you, so you just need a little bit more space there. You are basically tipping your body forward, so you create a nice long line from your head all the way down your spine to your leg, and then come back up. So let's just start with that as part 1. So can you keep your hips square? You don't want to rotate your hips. So if you had headlights on the front of your hips, they are pointed downward the whole time. Can you get to that tabletop position? Well, a little bit further. There you go. Yes. And back up. Yeah, that's fine. Okay, so that's just part 1 of it. Part 2 is once you've established that tabletop position, that nice long parallel position, can you bend your knee and touch the ground 5 times? 5 times. Yes.
Maintaining
the right posture through the spine and the leg.
And you want to not be turning out through that function, like the active hip, the one that you're not standing on. You don't want to be turning out and twisting your body, okay? You have to keep that pelvis square.
Good. I write it down a little bit, yeah. You know this, all right?
She's got it.
Make sure the knee is tracking in the midline of the foot.
And you want to make sure you're bending through the knee and not bending through your spine, right? So the knee is what should be bending to bring your fingertips towards the floor.
Yes. Okay. So you do 5, 4 out of 5 have to look really nice for that. Okay. The topple test is a single pirouette from 4th. So something that you guys commonly do if you're preparing for point. Great, fantastic, and go have at it. So that was a double. Was that a double?
Socks on carpet are always good.
Yeah.
Don't get rug burn.
So how that would look is that you have a nice tall trunk and you have a nice decelerated, controlled landing in the same position in which you started, right? That's okay. It's hard on carpet. This ideally you'd be doing with your shoes. Yep, that was very nice. Okay. Go ahead and try it. Yep. Get you a little more space for this one. Nice. That looks really good. That looks really nice. Yes.
Acceleration, deceleration, equality. Are they tipping? Are they over?
Okay. Lastly, single leg saute test. So, does everybody know what a double leg saute is? We can start with that. So we're in first position, we're plieing, and then jumping, up, down, okay? So a single leg saute would be, we lift the bottom leg behind us, and a coupe position is fine, and then you up and down on just that one leg. Yes, exactly. So the goal is 16 of those, with 8 out of 16 looking excellent. And by looking excellent, I mean the hips being level, right? So we don't want to see the hip dropping with every jump. The knee tracking over the second toe, midline of the foot. The trunk being vertical and upright and supported. Okay, so give that a try. Start with maybe 5 or 6. And then you can work up and...
Remember, too, you have to engage your foot, right? So when you're coming through, you're going to come up, roll through the toes, hit that pointed position, come down through the toes, and roll back down, right? So it's not enough to do, you're not doing this, right? You need to whoop, whoop, whoop. Okay? Maybe you can make the sound, because I think that's Yes, that was nice. Because in order to have it, because all of these tests are proving that you have the muscle strength, the balance, the coordination, all of that to then be on point, which we all know who've tried it, that it's not the easiest thing in the world, right? So it's one thing to just be able to leave the ground. It's another to be able to leave the ground, get that foot where it belongs, and get back down, okay? So you really need to bring that foot underneath you, get that pointed. Exactly. So everybody just do that. I'm in shoes, so I can't. But do it even without jumping. Get that motion going. So you really peel that foot, hit the point, and come back down. Our dance teacher is probably can show us this.
Prances, no jumping.
Right, so look how that foot comes off the ground and it kicks out into a beautiful point position and then rolls back through toes onto the balls of the foot and down onto the heel, okay? So now try it in the jump. And you're sauté.
Ballerina dream.
Yeah, keep getting there. Keep getting there.
Very good.
Good. So there's some really beautiful sautés happening out there, but now it has to be single leg and 8 of 16 looking awesome.
Yeah. So this is a very hard criteria. It is. So don't be frustrated if A, you're already on point and you're like, oh my gosh, I can't do this stuff, right? But take it for what it's worth. Practice all of these tests are excellent exercises on their own. So you can practice the test criteria, you know, and if you want further help, we're here to help you too, right, with that kind of stuff. So I'd like to move along because we have some exercises to show you guys, which we really wanted to get through. So we'll zip through those. Danielle is going to go through that. Hold on. Oh, there we go. It's plugged in.
Next, right? Okay, do you want me to tell about the handout first?
I would just say
So, hi, I'm Danielle Bergstead. I'm a physical therapist. I work here at the Sports Medicine Department. I've danced for 15 years, starting so young I kind of don't remember which age, but I think around 8-ish. I did ballet, jazz, modern, hip hop, and then later on I did African, and Argentine. So that's me. We added this essential foot care for dancing on point. For things that you should have, number 1 in your bag. Number 2, things to think about for how to take care of your foot. And then just some stretches, warm-ups, and then a couple exercises that you can put to work on. So some of them you could do every day if you get there a little bit early before class. Do as a warm-up, make sure you don't hurt yourself. And others are just to progress your strength as well, so you can get better on point. Progressing on to exercises. Top 5 exercises for dancers. Where's Jessica? Come on over. So the first one, and actually, let's all come out here. Let's all do it together. You guys have bands and
Everyone should have a band. Yeah, camera.
Yeah, I can turn it to the camera. Is it not on? This one? Right here.
It's on. I just don't know why it's not showing.
Oh.
There we go.
These are like levels.
Yeah.
There. No? Okay. There we go. So for this exercise, we chose this one specifically for working on your plie, working on your turnout, working on your développé, all these things that are pretty important to any basic ballet class, especially if you want to progress through it. So I call it the butterfly. So what you do first is you lift inside line with the band above your knees, and I like it above your knees, not on your knees, because we don't want to irritate that patellofemoral joint she was talking about. Lift up your heels. Lift up the top knee, turning out as much as you can from your hip without letting your pelvis rock back. Keep your heels together. Go ahead and straighten that top knee out, keeping the turnout that you've already created. That's the tough part. Excellent. Keep the turnout, bring the foot back in so the heels touch each other. Excellent. Drop the top knee down slowly towards the bottom knee. Excellent, and both heels go towards the ground. And that is one complete butterfly. Okay, one more time. Both heels up. And I will also mention that it's nice to keep a little space right where your waist is, in between your waist and the floor, showing you have a lot of control through your core as well. Lift the top knee up with good turnout towards the ceiling without letting the hip rock back. Straighten your knee. Bend the knee back in with your heels touching each other. Drop the top knee down. And then both heels drop to the ground. Nice work. So did anyone feel that exercise working on any particular muscles? Could you see how it might help you with your turnout, your plies, all those? Yeah? Any questions? No?
How many repetitions of this kind of thing are you thinking?
I think about 3 sets of 10 would be good, each side. You could also just go to fatigue 3 times, and that's a good way to start.
Does everybody know what that means? Go to fatigue? So sometimes, so she said 3 sets of 10 to begin with. How many people think they can do 10 of those really, really well right now? Some people might not be able to, right? Maybe you could do 4 or 5 really, really well, and that's all you do. You do 4 or 5 really well, then you rest. Then you do 4 or 5 again really well, then you rest. And then you work up to it. These are muscles that you have to build to get stronger, and it takes time.
Okay, next one. Go ahead and lay on your back. Take the band off. It's called a single leg bridge tap. So remember when we were talking about a nice neutral spine where you can probably slide a little pencil right underneath your spine? Let's find that position right now with our knees bent. Go ahead and pull that belly button in towards your spine. Raise one leg up straight up towards the ceiling, and I really want that knee to be nice and straight. So if you can't keep it straight up towards the ceiling because your hamstrings are tight, you can lower it down a little bit so your knee can get straight. In this position, you're going to push your weight into your heel using your glute. Lift your buns up, off the ground. Good. Another nice cue for this is to keep your shoulder blades on the ground. So, you guys know I'm holding that for a second. Are you doing that? There you go. Okay. Now that we're in this position, you're going to slowly lower your foot towards the ground, keeping the height of your pelvis up and that knee straight as much as you can control it, and then bring it back up towards the ceiling. Again, the knee stays straight. And then you can repeat that again. Just do it 3 times, a good number.
Just like when you're standing and you're doing something, that leg that's bent, that the foot is on the ground, that's your supporting leg. That's your rooted leg. So it should be nice and strong.
Don't let those hips sink. Keep those hips up. The last one. It's the last one. You can do it. And then drop your hips towards the ground. Bend your knee. Place your foot on the ground. That is a single leg tap. So I would say do 3 times if you can on each side, and about 5 reps I think is appropriate. But again, pay attention to fatigue. If you can do one really well and the second one doesn't work out so well, stick to the one until you can add the other one really nicely. So every one that you do has really good form and technique. Question? Okay, now we have the Adductor Series. These are your muscles that are just on the inside of your thighs. They help with your releve, like we were discussing before, your pirouettes, your développé, and definitely your entrecots. All right, so lay on your side. Match. Oh, did I not? Oh, it is. The bottom one. We're going to take our both legs straight out. There we go. We're going to take the top leg, turn it out, and just place the toe right on top of that knee, like we're about to do with pirouette. Now, one thing we want to think about now that I'm looking across, you guys, is we want to keep that hip down. So, if you can't hold your leg there without letting your hip pop up, why don't we just make your hips stack up a little bit nicer and drop the knee a little bit lower? Do you know what I'm talking about, Suzanne? Can
You mean dropping the foot more like this?
yeah, so
Yeah, just super
because we want all the motion to come from our hip joint and not from our side.
that position.
All right, once we find that, you're going to lift the bottom leg up towards the ceiling. That top leg can give you a little bit of resistance, just to make it a little bit harder. And then down, and then up, and then down, and just keep. Does anyone feel their inner thigh working? Good. Let's do another 3. You guys got this.
Keep that hip from moving faster.
2,
Go.
3. So now we're going to straighten both legs out parallel. We're going to have the top leg hover right about hip height. And we're just going to bring the bottom leg to the top leg, up and down. Top leg just stays there. Now, one of the challenges with this one is actually keeping that knee straight on the bottom leg, keeping your core engaged. So this is another time when we can really focus on keeping that little bit of space underneath our waist, so we know we're in control of our spine.
Albany High, what's going on over there?
You can take your hand and kind of put it right on your waistline to make sure you've got a little space there, right? Check in frequently during these sideline exercises to make sure that space is there.
And you're doing a great job of keeping both shoulders facing forward, both hips facing forward. That's fantastic. All right, 2 more. And lift. And lift. And both legs come down. Now this one, we've added a ball to it. So if you don't have a little ball at home, you could use a soccer ball or just a squishy ball that you can buy for like 99 cents. Or you can roll with a towel. That will work up too. Okay, see? Okay. So now what we're going to do is we're going to hug the ball with our ankles and lift both legs up in the air. And down. So we're getting our adductors and we're getting a little bit more of our core with this. You know, I was speaking with you about your obliques. This will build up some of your obliques.
You can probably feel it, right? Yep. You're doing a great job maintaining that space.
If you're having a hard time balancing, you can put your hand in front of you, right? Create kind of like a little teepee with your hand for balance. That'll be easier versus putting your hand on your hip is harder, right? So it's fine to put your hand in the front as you're learning and this new exercise and find it challenging.
Okay, and two more. Nice job, Steve. Use the water.
There you go.
And when we're using our adductors, I'm going to just add this a little bit. I want you to think about using the pulling from the seam of your pants. So right where the seam of your pants is where you're pulling from. Sometimes people pull from too far in the front. They actually end up turning in their knees. You want to pull a little bit from behind. Okay, so that's a nice cue to think about when you're doing that. Okay. Next one, on our belly, swimming. Everyone can do this. Arms and legs stretched out. And like always, we're going to start with pulling that belly button into our spine, engaging our core. Now just let your arms and your legs hover above the ground. So lift them up. Make sure we can get this position. Nice job. Now your left arm goes up towards the ceiling while your right leg goes up towards the ceiling. Good. Hold that for about 3 seconds. 1, 2, 3, and switch. 1, 2, 3, and switch. Good. And just go back and forth. I like using a timer for this because I think it's a lot of effort to count. 30 seconds is a good amount of time to do. Because then you can really focus on your core.
Make sure your face is floating off the ground too. Yeah, bring your face to your neck
too.
Don't leave your face on the ground.
Look at your hair is blocking. You can tell if your face is on it.
But this is fantastic for your arabesques, your attitudes, your penchés. We all want better of those. Okay, last one. Number 5, the mermaid. Okay. Go ahead and get into a modified jazz split. And, I didn't bring the foam roller.
It's okay. Yep.
You can use a foam roller with this or nothing. It's a little bit more fun with the foam roller. So what you're going to do is you're going to start raising one arm up over your head into high fist. You're going to lift up, keeping your core engaged and side bend through your upper back down towards the ground. Get a really good side bend. Once you feel like you've gotten a really good stretch, you're going to twist through your core and put your other hand right next to the, about like a foot away from your other one. Now when we're in this position, slide your hands away from you. Get a really good stretch through your upper back and your lower back, keeping both hips level and as far down on the ground as you can so you reach back with that back hip. All right, now we're going to come up just a little bit. So come up just, stop right there and then arch through your upper back. So look up towards the ceiling, bring your chest up towards the ceiling, open through your clavicles. You should get a really good stretch. This is great for your combres. You know how hard it is to get your upper back to move and not just your lower back? This will fix that. Go back down into the stretch with your arms extended. Lift your top arm up back into high fist and come all the way up. Set that arm on the ground. Take your other arm up into high fist and just do a nice light side bend right when you get there. Really breathe into that rib cage that's facing the ceiling. And then exhale and return to neutral. This is the mermaid. There you go. Any questions? That was a hard one. More like
Good one for the back though.
But yeah, it's really great. A lot of dancers get really stiff through the thoracic spine. It's not something people think about a lot, but the rib cage doesn't really like to move. They try to get their stability from where. And then when you get to your combre, all you can do is use your back. So this will help you loosen that up a little bit.
And it's good to stretch your hip flexors too, because when you rotate away, you get a nice stretch through the anterior part of the hip. You can go back. You get this stretch through here, unless you're cheating and lifting up your pelvis, okay? So you want to think about not just that stretch through your back, but through the front of that leg too, and then you'll do it the other way.
Okay.
Good job, you guys.
I hope,
That is it. That is all of it.
yeah, I hope you guys learned a lot, okay? And just to let you know,